Awesome. Good afternoon, everyone. I'll be picking up a conversation around intimate partner violence and really focusing on how adolescent mothers are at risk more of experiencing intimate partner violence. When we think about COVID-19, we kind of all say things were bad. COVID-19 just made things worse, right? And this presentation will just be highlighting what happened for IPV among mothers who were living with HIV compared to those who were not living with HIV. We measured IPV using the WHO scale, which basically comprises of 13 items, 6 looking at psychological IPV, 8 looking at physical IPV, and 3 looking at sexual violence. There were 3 questions that we really wanted to ask. Was the proportion of adolescents experiencing IPV increasing due to COVID-19? And was this increase happening equally for those who are living with HIV compared to those who are not living with HIV? And so we used data from a study called the Hey Baby, which had baseline in the year 2018 and 2019, recruiting 1,046 adolescent mothers who had a mean age of 18 and had at least one live birth at that time. 30% of those women were living with HIV. COVID happened, and then we had to follow them up remotely. So between 2021 and just maybe 2 months ago, we ended the follow-up. And I'm using data right now for 67% of the cohort. There's not much difference between those included versus those who are not included. But the people who are living with HIV are now 35% for the follow-up analysis. And so what do we see? During COVID-19, 1 in 5 of our adolescent mothers experienced IPV in the last 12 months. So this is either psychological, physical, or sexual. The rates of psychological, so like humiliation, saying something bad to you, were the same as physical, being insulted, shoved, beaten, as well as threatened. Sexual IPV, so being asked to have sex when you didn't want to, or feeling you could not say no, or actual forced penetration, was 4%. 1 in 10, is really important thing to note, had more than one form of intimate partner violence subjection in the last 12 months during COVID-19. We then said, how do these rates actually compare to before COVID-19? So before COVID-19 is shown in the dark black, color, and then the gray shows during COVID-19. And what we can see, for all these 3 types, psychological, physical, and sexual, there is an increase. There is an increase as well for any, which is at least one form of IPV, as well as for poly, more than one form of IPV. So throughout, we see an increase during COVID-19. We then take a step back and say, well, let's look at the COVID-19 rates and say, do they differ by HIV status? Those in orange are adolescent mothers who are not living with HIV. Those in blue are adolescent mothers who are living with HIV. And we can see the blue tends to be higher than the orange, an indication that those who are living with HIV are more vulnerable to intimate partner violence, specifically psychological and physical intimate partner violence, and then any as well as multiple forms of intimate partner violence. Then we said, fine, there is an increase. Is this increase happening the same? So if there's a 5% increase in sexual violence, is the 5% increase for those who are living with HIV also a 5% increase for those who are not living with HIV? Same thing, is this 5% increase happening among adolescents who are still teenagers at follow-up? Is it also happening for those who are now older, between 20 to 25 years of age? So what we want to see for psychological, those who are living with HIV are still in orange. They had a 7% increase, and then those who are not living with HIV have a 4% increase. So somewhat the same. When we look for physical, however, it's quite different. There's a big difference in the proportion of increment in terms of physical IPV. Among adolescent mothers living with HIV, 17% increase since COVID-19 compared to 11% increase among those who are not living with HIV. Sexual violence, the increase was the same, ranging 2 to 4%. And then when we look at early, there's a 4% difference in the increase. And for poly is the same. So again, we see that adolescent mothers living with HIV were at risk at the beginning. COVID-19 increased rates, but it increased rates more for adolescent mothers who are living with HIV, specifically physical intimate partner violence. Then we said what happens with age. We saw for psychological IPV, something we're still trying to understand, that those who were between still teenagers, there was an increase of 10%. But for those who had become young adults, that should be 20 to 25, there was a decrease of 4% in terms of psychological intimate partner violence. The increase in physical IPV due to COVID-19 was the same. Sexual violence, the same. And then for any, we see that teen mothers at follow-up had a 10% increase in any IPV compared to 8%, but still the same. So what we're seeing here is that actually when it comes to age groups, the only difference we're seeing is in psychological intimate partner violence with caution, but overall, despite of age, adolescent mothers still experience the same amount of increment in IPV due to COVID-19. So what were the stressors that COVID-19 really picked on? It had to do with the household. Among those individuals who had a change on who was living in the house, as well as there was an increase in conflict in the house, were more likely to report subjection to intimate partner violence. Those who did not know the HIV status of their partner also were more likely to experience IPV, in addition to being in an age-desperate relationship, so having a partner who was 5 years older than the adolescent mother. Food security, as well known, still came out as a very strong predictor of experiencing COVID-19 later on. So what should we do given this huge population we're expecting by 2050? We need to encourage screening of IPV in all our services, be it HIV prevention or care. We need to promote positive relationships that speak about intimate partner violence and we're able to solve problems or conflict in a non-violent manner. And we need to focus on how we can encourage and support food securities within all our contexts. Thank you so much.